Hello, um, my name is Dr. Hong Bum-moon. I'm a lifetime diplomate of American Board of Orthodontics, and also I have a private practice in Seoul, Korea, and Los Angeles and California for the last 30 years. I've been a former faculty at UCLA and USC Department of Orthodontics. I'm going to give you a lecture. The title is 5D Challenge in Orthodontics. I'm going to cover 3D challenge first, and then later on I will extend to the 4D, which is time, and the 5D, which is new trends and technology, including AI. I'm going to give you two inspirational quotes. Number one, by Helen Keller, she said, many persons has the wrong idea about what constitutes the true happiness. It is not attained through self-gratification, but through fidelity to a worthy purpose. The key words here is self-gratification is not the covering the true happiness, but the fidelity to a worthy purpose is actually making your life, yourself happy. The second quote is, when we accept tough jobs as a challenge and wade into them with joy and enthusiasm, miracles can happen, by Harry Truman. I love the words the joy and enthusiasm. If you accept the challenge, with the miracles probably will happen if you have a joy and enthusiasm. This slide shows the company ad inside the box. Can you imagine what is this company in terms of ad? And you'll see the next slide is Xerox. And you'll see whole company name out of the box. So we'll think about the paradigm shift and out of the box and probably outside the envelope. This slide shows the envelope. You see the tooth movement range. The black shows non-extraction. The inside red is extraction, and outside red envelope is surgery. So the range of tooth movement. So we call this as envelope of the tooth movement. Can we challenge like outside the box or outside envelope? So I'm going to address this with the 3D dimensions. So I call this as a 3D challenge in orthodontic treatment. So first AP and vertical, and lastly transverse challenge. The reason I call 4D challenge means we call, by Einstein, the first dimension is time. So the time means very early treatment or very senior, the old patients. Can we do it, and what kind of treatment can be done? The lastly, 5D challenge means, so we have certain technology and new trends that we call, including AI. Probably this will be another challenge in orthodontics now and also in the future. So I will cover 3D challenge in AP dimension first. So this is a class 3 cases. We call comprehensive cases and adult class 3. So you see this slide, anterior crossbite, and you can see the patient, the front and the profile, the face. You see very concave profile and high angle. The teeth, the upper right canine is completely blocked, and the lower left second premolar was missing. And very narrow arch and blocked canine and very crowded the lower anterior incisors. The panorex, you see the one tooth missing on the left. And then as you see in the ceph is a very, very high angle. And of course, anterior crossbite, skeletal class 3. So from the cephalometric analysis, you see the A and B is -8. And width is -15. Over jet is -7. GOG and SN is 37. Very high angle. So if A and B is -4, that is more like surgical case. In this case shows -8. The treatment options. What do you think? How can you treat this case? Of course, a lot of people, including myself, the diagnosis was two-jaw surgery. However, this patient actually shed the tears in front of me, and she explained that she was searching for non-surgical specialists in orthodontics, and she did. And I was the number 11th orthodontist. So 10 orthodontists, actually including myself, I suggest for the two-jaw surgery. The reason she cried because she couldn't handle the surgery. She had a huge trauma when she was very young as traffic accident. Number two, she had also recent surgery of heart. It's a heart valve problem. So she cannot handle any more surgery at that time. So she said, you know, Dr. Moon, is there any way you can do without surgery? So I scratched my head, you know, what should I do? I never done this kind of severe cases with non-surgery. However, I thought again, because if I say, okay, I can't do that, or she has to go to number 12 orthodontist. So I don't think anyone can treat this case with surgery. So I decided to go for non-surgical approach. I just want to show you, this is dart, you know, the dart game. So hopefully you can hit the bullseye. You can get a draft beer or something. But usually you use a one dart to hit the bullseye. But this time I said to her, I want to use many darts, maybe with closed eyes. I want to throw all the, you know, darts. Hopefully one hit the bullseye. And that's how I explained. Because there's no evidence, there's no cases shown in any textbook or any previous lectures. So I dare to try or challenge. But as I said earlier, with joy and enthusiasm. So yeah, she has a missing left second premolar and crossbite class 3 molars and concave profile and skeletal issue, but no surgery. So what I did, extraction of the other side, which is the lower right first premolar, and I expanded upper, and she used a face mask and class 2, class 3 elastics, and to correct the asymmetry. Patient motivation was excellent. Here's what I wanted to tell you. It is a big challenge, but one time I came to my clinic in the lunchtime. I saw one lady was driving with a face mask on, like an Iron Man, and she just passed by. So I realized, oh my gosh, she's a professional, but you know, she was wearing this face mask even in the daytime. So compliance was amazing. I kind of felt that, you know, probably the miracles could happen. So what I did is I expanded with the expander, RPE, and then it expanded very well. So upper, we expanded very well, and then lower, and face mask and the lower arch and the jaw actually came back and downward and backward. So the A and B became actually -4, so, and then width is -10, and overjet and actually is now changed to positive. So far the favorable response. And the superimposition showed, and the lower jaw is clockwise rotation, downward and backward. So A and B changed from -8 to -4. And this is a patient's smile, which is much better. So they're showing the before and after. Okay. So anterior crossbite has been corrected. And the other side, the extraction space or missing space was closed and positive overjet. And upper arch was expanded very well, and canine, upper is non-extraction, and then canine was inside the arch very well, which means great expansion. Then lower arch also coordinated, and it finished very well, and even if a high angle, her face also looks much better. So this before and after, you see that she looks very great, and actually she got married after that, and then shedding another tears. And it was amazing for me, and then how she was compliant and full cooperation, and of course I did my best. However, can you say this is success because it's improvement? Or you may say this is failure because it's a compromise. It was a surgical case after all. But my question is, what if this patient was your family member? What would you do? Just you want to leave this patient alone? Or you can still challenge as I did. Okay, that's up to you. The another AP challenge is we call mini screw cases or TADs. So she was actually diagnosed as a surgical case, and she started actually in the other office, but extracted upper second premolars. But somehow she changed her mind, and she was searching for a non-extraction, non-surgery orthodontist. So she came to me, but it was frustrating that all upper teeth were taken out. So I had to use a mini screw, which is TADS, and try to move the lower whole anteriors back with absolute anchorage. She looks much better, and the anterior bite, crossbite was corrected. And this is another challenge, which is experimental cases for early class 3, and then we use the mini screw with a face mask. I have a few cases, and it has been excellently going well. And she was wearing face mask with the 2 mini screw with TADs. Her profile has been changing favorably. And 3D challenge transverse dimension. So now we are going to talk about transverse challenge. We just covered the AP challenge. Now the different dimension, which is a transverse challenge. So this is adult posterior crossbite cases, and severely crowded. And then she went to the other orthodontist and recommended 4 teeth extraction. And somehow she wanted to have a second opinion. She came to me. So I decided to go for non-extraction, even if she's an adult, very narrow arch. And it could be done on a surgical expansion, but I decided for arch expansion for this case. So I diagnosed this as a non-extraction and expansion. And I didn't use RPE. Instead, I like to use the expansion arch for this case. So treatment options, non-extraction, expansion arch. So you see initially the patient was very crowded, and then I started to put the braces and just as minimum as possible in the beginning, and try to use expansion arch with open core spring, and then try to unravel the crowding in the upper first. And then once I'm done in the upper, I'll start to the lower, try to correct and then coordinate an upper and lower with the intraoral elastics, and then I finished very well with the class 1 occlusion. And as you see, her case was finished very well, and the reason I didn't take any teeth out because she has a very straight profile. So I didn't want to do dish in and then to make a more straight up or concave profile. So before and after initial and final, you see the teeth has been expanded and all crowding has been corrected. And you see her face is very similar, but it's not bad at all. So we try to treat the patients with the face, not only for status of the teeth positions or crowding. So the final challenge in 3D is vertical dimension. Okay, there's molar intrusion cases. You see sometimes upper molars actually extruded, and the patient need to have implant on the lower, but there's no interdental space. So in that case, either you have to root canal or the crown, or you basically you are going to mutilate the one molar. Instead, we use a TAD and try to intrude the vertically so that we can save the tooth. You see that the molar intrusion and the mini implant or TAD, I used 4 TADs in the buccal and mesial distal and palatal mesial distal. So I can use vertical, true vertical intrusion. So about 1.5 millimeter intrusion in 1 month. I wanted to have a 3 to 3.5 millimeter intrusion. Actually, that's a goal. That has been extruded, I believe it's 3.5. So after stabilization, the teeth were pretty stable after the intrusion, so patient could do the implant on the bottom. Another vertical challenge is open bite, anterior open bite. And this patient showed huge open bite, only molar is touching, and somehow this patient was actually frustrated because restorative dentist was trying to do full mouth rehabilitation for this open bite cases. And some of my colleagues actually found this patient and then say, oh my God, you have to get the orthodontic treatment done. So that's why she was referred to me. So I put the mini screw for this case. She has a huge open bite. So I try to put the mini screws in the back, and the treatment options, of course, you have many different options, but I decided non-extraction. So the more like occlusal plane change. So molar can be intruded, the anterior teeth can be extruded. As I said, the occlusal plane can be changed. It's like a posterior impaction case in surgical. So her response was amazing. Even in 1 month, the front teeth is touching. And so in other words, open bite has been resolved. She could eat. And then after vertical elastics and mini screw, her case has been going very well. even 1 month, and after the 5 months, and teeth getting touched all the way. So you see that the initial and progress, and then in 1 month, and then also 5 months. On the left and on the right side, both are touching very well. And you see the patient start to smile after 5 months in progress, and then she can close her lips compared to the beginning. She couldn't close her lips because the bite, open bite cases. So now she could close the lips, and then she can eat and cut the teeth, cut the food with the front teeth. Okay, the class 2 deep bite, which is another challenge in the vertical dimension. So if you have a gummy smile, of course you can do surgery, but this case, I put the 2 mini screws attached the front between central and lateral incisors and try to move the whole anterior segment up. So compared to the beginning, the deep bite has been open. Now the gummy smile has been gone, and her smile is much better than beginning. So far I just explained about the 3D challenge, and then the time, which is another 4th dimension, and then 5D challenge, which is another technology such as AI and new trends, which I will cover later on. And thank you very much for your attention.